The first thing I want to go over is some soft tissue mobilization. So when we're talking about the soft tissue we're going to work on, we're going to really get into the subclavian muscle, but some of the pec muscle as well. We're going to start over here, and then you're going to just press in and almost a little up under that collarbone. I do not use lubrication when I do this type of work. It makes everything too slick, and there's no way that you're going to really be able to feel what's going on. So I'm just sort of sliding, and if you feel a part that gets kind of sticky, then you're going to stop there. Take some breaths, relax. The whole time you're doing this, you are working towards relaxing more and more and more. So my shoulders slowly letting go as I'm doing this. I'm letting all that tension that we have go. You can go back and forth, but the whole time the pressure is in and up. Keep working across. Now I'm showing you guys on my right side, and after I get over here, I want to do a backtrack. I want to show you guys something on my left side. For those of you that have been following me since I have a pacemaker. Now, when you get right in here, boy, this is the fun spot. This is where you'll really start to feel it. But I wanted to make sure and start over towards the middle, because we don't always just want to go straight to that particular area and what we might call straight to the source, because the reality is most of the time it's not. When we're talking about fascia, it's usually surrounding areas that cause the bulk of the issue. All right, and then I'm going to kind of finish it out. You're going to follow it till basically you're going to get all the way to the end of the collarbone here. And for me, it gets real easy to see because I have this one little bony part that sticks up. And basically, that is the end there. Now, if you're dealing with a pacemaker and you're having issues on the side of the pacemaker, you'll just be a little extra careful. So right here, and you guys might be able to see, that is my subclavian vein. And that is where the wiring is. So I don't want to press specifically on the wiring, so I just come to the inside, and that would be where I would stop. I would still work all the way through until I kind of get to that inside. Sometimes I'll kind of feel ahead with that finger, kind of where I am, or you can come off the vein and work backwards is also an option. And then of course you're going to come down the other side and work through. So just make sure you're lifting your fingers when you go right over that vein for those of you that have a pacemaker.